I'm sure you've been asked this before and I will have to ask you again. In 2019 po, hindi maganda yung inyong karanasan dahil sabay kayong tumakbo ng inyong kapatid at sabay kayong tatakbo ulit ngayon. So ano pong pagkakaiba ngayon o ano yung inaasahan yung pagkakaiba ngayon na kayo'y makakalusot dahil maghahati kayo ng boto?
Well, talagang given the circumstance, Ed, Ami and Luchi, talagang this will be an uphill battle for me. I know that it's an uphill battle, but it's not anymore issue sa akin. It's not anymore the sibling rivalry. What I really gave it much thought. Talagang pinag-isipan ko na matindi dito dahil with both of us running it, talagang yung pagtakbo namin dalawa, it will be 2019 all over again. Tama ka, no? Na mabigat ang circumstances. But with the prevailing situation right now, especially with the COVID pandemic, at yung nangyayari ngayon ng mga problema, like for example, yung pag nagkaroon ng surge, yung kakulangan ng bed ng hospital beds, hospital rooms. Pangalawa, yung problema sa mga health workers, no, yung benefits. All of these things are in universal healthcare law. No, kaya being the principal sponsor and author, Ami, Luchi, and Ed, parang I cannot help but do something about this, no? Na parang hindi naman pwedeng nakaupo lang tayo dito. Alam ko mabigat ang laban pero sabi ko susubukan ko pa rin. I think it's my obligation and my mission to really complete, no, to make sure that the law, the universal healthcare law, is implemented properly. Because passing it, pasado natin is half of it, eh. But implementation and the push for it is the other half of it. At alam mo, Ed, Ma'am Luchi, Ma'am Ami, it would have been different if the principal sponsor were there right now for the implementation phase, lalo na sa infancy. No? Iba po yung pagtingin ng principal sponsor at author dito because he knows the history, he knows the intent of the law, and being the principal sponsor, syempre baby ko to. Na talagang sisiguraduhin ko sa budgeting, sa implementation, sa oversight, I'll make sure that this will be implemented properly. Unang-una po, yung nabanggit ko kanina, yung sa kakulangan ng bed capacity sa bed hospital rooms. It is included in the universal healthcare law, yung expansion, increase in bed capacity of the hospitals. Lahat po yan kasama po rito eh. So it's really a matter of implementation.
Assuming that you win, no? How soon can we actually feel tangible improvement naman? Kasi ang tagal din naman bago maisakatuparan yun. Plus, you're now facing an economic environment that is vastly different from the way it was in 2019. And it was already a challenge then, no, to actually implement a universal health care.
Yes, you are correct, Ma'am Luchi. No? Talagang sayang, no? That the timing that it was passed, it implemented, nagkaroon naman po ng pandemic. But looking at the situation right now, ma'am, with this pandemic, it exposed out the weakness of our healthcare system. No, na all the more, I would think that we really have to implement the universal healthcare law properly and give priority. Kasi nga po, ma'am, yung problema lumalabas, which I mentioned, yung kung kulangan ng hospital rooms, no? Lahat po yan, it's in the universal healthcare law. Yung expansion, yung increase in bed capacity. But it's a 5 to 10 year program. Hindi po pagkapasad ng UHC, maganda na po lahat. It's a 5 to 10 year program for us to realize na talagang lahat ng hospital system natin ay maayos na.
But ngayon hindi nila ma-implement, no? Pati yung increase, halimbawa, sa PhilHealth, yung, di ba, nanatili sa 3%. No? How do you hope to be able to push it, even if you're back in the Senate, given that the economy will still be in shambles by then?
Well, Ma'am Lucy, I think we still have to prioritize this, no? And make sure that I was vice chair of the Committee on Finance back then and chairman of the Committee on Health. Kaya it was an advantage. I could have, had I been there, I think I would have more funding to make sure that UHC is implemented properly. As I mentioned earlier, I'll make sure that the line items, to the budgeting, will be we can allocate the funds needed for its implementation, no? Lalo na po sa improvement ng health facilities, especially in the supply of the health workers. Also, Ma'am Lucy, dapat hindi po nangyayari ngayon na they work from 12 to 16 hours tapos yung benepisyo lang hindi po nabibigay. Dapat po yan, no? They have to be justly compensated as well. No? It's stated, nandun din po sa batas yun. No? So, ma'am, I'm hoping that if I'm given the chance again, if I make it to the Senate, I'll make sure I will oversee the implementation. I hope that it will be implemented properly. It is being implemented, but I have to be honest with you, ma'am, that it could have been better. Being the principal sponsor and author, I think I have to be honest that it could have been better implemented kung nandun sana yung principal sponsor. Because alam niyo, Ed, Ami, and Ma'am Lucy, as principal sponsor, you know the history, you know the intent of the law. So, talagang mababatayan niyo po. So, I'm hoping that I'll be given the chance na ayoko naman pong iwan po ito. No? Ang ganda pakinggan, UHC, Universal Healthcare Law. Ed, kaya lang, parang kung half-baked naman na hindi na-implement properly, parang I will find fulfillment if I see the law that is really being felt already.
Opo.
By the time na I would leave the law already as implemented. So I feel it's my mission and it's my obligation as the principal sponsor of this measure na pangako natin to sa ating mga kabayan na I really wanted it to be implemented properly, na maramdaman, no? That it will be felt by everybody.
Yeah. So waiting for another 3 years is not an option for you.
Yes, ma'am. Because the way I see it, yung 3 years na nawala po ako, I think in its infancy,
Critical
it
3
would
years.
have helped a lot. Yes, you're correct. In its infancy stage, it would have been better if it would have been better the principal sponsor been there to make sure and oversee that this law is implemented properly. Alam mo, talagang po ako Ma'am Lucy, Ma'am Ami, and Ed, with what is really happening, I really have to I have to take this gamble. At least I tried. No? If I make it, then well and good. At least I will be able to scrutinize the budget very well. I will oversee its implementation. If I that, at least I tried. No, na wala akong regrets of not trying, not at least trying. No, to really try to be back.